how to avoid getting infected. There are a few measures one can take to avoid getting infected or to lower the chances of you contracting the virus. The first one would be frequently washing your hands with soap and water, or thoroughly cleaning your hands with an alcohol-based hand rub. It is also essential to maintain social distancing, at least 2 meters distance between yourself and anyone, just to be safe, especially if they're coughing or sneezing. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. If you're too close, the droplets might get in your hands, face, or you may even breathe them in, increasing your chance of infection if the person coughing has COVID-19. Another thing you need to do is avoid touching your eyes, nose, and mouth, essentially your face. Because our hands are the busiest part of our body, they come into contact with a lot of potentially contaminated surfaces and can pick up viruses. Once contaminated, your hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and make you sick. You need to practice respiratory hygiene by making sure you and the people around you cover your mouth and nose with a bent elbow or a tissue when you cough or sneeze, and dispose of the tissue immediately. Good respiratory hygiene helps protect you and the people around you from viruses such as cold, flu, and COVID-19. Please stay home if you're not feeling well. If you have a fever, cough, and difficulty breathing, seek immediate medical attention and call in advance. Calling in advance will help your healthcare provider to quickly direct you to the right medical facility. This will also ensure that you get help as soon as possible and prevent the spread of the virus, as you'll be taken to the right facility immediately. To stay safe, keep informed on the latest developments about COVID-19 and follow advice given by your healthcare provider. Why? The national and local authorities will have the most updated information on whether COVID-19 is spreading in your area. They are the best place to give advice. When to use a mask. If you're healthy, you only need to wear a mask when you're taking care of a person suspected of having COVID-19. Only wear a mask if you're coughing or sneezing. Key note, masks are effective only when used in combination with frequent hand cleaning, either with alcohol-based hand rub or soap and water. If you decide to wear a mask or is directed by our government, you must know how to use it and how to dispose of it. Let's look at when and how to wear a medical mask to protect yourself. Before putting on a mask, clean your hands with alcohol-based hand sanitizer or soap and water. Ensure you cover your mouth and nose with the mask and make sure there are no gaps between your face and the mask. It is important to avoid touching the mask while you're using it. If this happens, clean your hands with sanitizer or soap and water. Don't forget to replace the mask with a new one as soon as it's damp, and never reuse a single-use mask. How to remove the mask. Always remove the mask from behind and make sure you do not touch the front of the mask, and discard immediately into a closed bin and clean your hands with hand sanitizer or soap and water. This is meant to safeguard you and the people around you to stop the spread of the virus. Prevention is best. Stay home, stay safe.